Well, I'll just mention one other finding that we're presenting at this meeting from the Aristotle trial is around tolerability, because tolerability is very important of drugs in general. So many people, about half of people who start on a drug that's proven to be effective, stop it within a year because of intolerance to the drug or ineffectiveness, or sometimes just lack of adherence, because as human beings we tend not to be so good at reliably taking things, even things that are proven to be helpful. We're reporting at this meeting more details in the Aristotle trial that in fact apixaban was better tolerated than warfarin, and more patients remained on apixaban than on warfarin in a double-blind trial. So patients didn't know which treatment was being administered. There was a placebo and an active drug for each patient, and patients were less likely to come off of their drug if they were on apixaban, which speaks to its tolerability and its lower risk of bleeding. So for the patients who came off of it, many times they were not treated with any anticoagulant. Sometimes they would go on to an open label drug after coming off the study drug, which would have been warfarin. So our future research, and it's such an important area, is to try to better understand why patients are stopping these blood thinners, these anticoagulants, and then come up with tools for providers and for patients to improve the likelihood of patients staying on these treatments which are so important to prevent stroke. And that includes reminders, it includes education, it includes, for example, avoiding aspirin, because patients who take aspirin in addition to a blood thinner are much more likely to have bleeding and problems with their stomach, and therefore avoiding aspirin is an important strategy to help people tolerate blood thinners. Yeah, so there are lots of other important findings at this meeting. Lots of large trials are being presented that will really help cardiologists and internists around the world improve care of patients with heart disease. For this particular question and an issue of optimizing stroke prevention for atrial fibrillation, I hope what this particular finding will do is it will allow healthcare providers to feel more comfortable treating a larger proportion of patients who have atrial fibrillation and risk factors for stroke with anticoagulants. And then that will result in strokes being prevented, which is the most important outcome that we could achieve from this work.